Hello, I'm Dr. Xiao.
I'm Dr. Chen.
We come from the Department of Gastroenterology and Hepatology with the China Hospital of Strange University in China.
We recently published one article in JIE, the application of endoscopic pulse string suture in refractory nonvariceal gastrointestinal bleeding. This is a retrospective study conducted in 3 centers of China.
So why we think we need to conduct the study? Just because that the endoscopic pulse string suture, we also call the PSS technique, is actually used in the ESD or EMR to close the post-operative lesions. And then we consider that maybe this technique is also useful in the bleeding cases, especially for rebleeding cases by pre-bleeding point. And actually, in some centers, especially in our center, some doctors have done this in the bleeding cases, but we do not know whether it's really effective or just some personal bias. So we conduct the study. So let Dr. Chen to introduce his experience about the PSS.
Okay, I use the PSS to treat emergency bleeding cases, and I found it could achieve hemostasis in large ulcer, especially in refractory bleeding cases with unhealed ulcer. I have an emergency case. The patient occurred bleeding because of 3 centimeter gastric angle ulcer and the coagulation at clips. All tried but failed. I used the PSS to close the lesion. The patient did not recur bleeding in the following.
So would we add our study add to the existing knowledge? We think that we demonstrated that the PSS is really useful in the refractory bleeding cases. So we need to try if there is our bleeding cases. Actually, we know that the exposed lesion is really a risk factor for the bleeding, especially in the upper GI tract with the acid irritation. So we think that's why the PSS is very useful because it could help to close the lesion and to help to stop the bleeding. And maybe Dr. Chen also have some experience, personal experiences about such refractory bleeding cases.
By now, there are some studies showed OTC is effective therapy for refractory bleeding. OTC could close ulcer up to 2 centimeters. However, there is no special size limitation in PSS. Besides, the OTC is really expensive, and in some areas or centers, OTC is not available. And so, what should we do next?
Still, our study is retrospectively observational study.
Yes, and we need more.
Yes,
studies.
just some prospective study to compare the traditional treatment like clips with PSS or even the OTC with the PSS to learn which one is more effective in refractory bleeding cases.
Yes.
So thank you for your attention,
Thank you.
especially for our study. Thank you.
Thank you.